My name is Dr. G, and I'm an internal medicine physician in Hollywood, Florida. I consult on over 300 patients a month on lifestyle modifications and GLP-1 medications. I'd like to talk to you about 10 of the most common mistakes people make when they come into the office, and I talk to them about GLP-1 agonist medications and how to inject them. Now, this list is not in any specific order, but let's start with number one. Incorrect site injection. These GLP-1 agonist medications are built or made to be injected in the subcutaneous space, which is under the skin, but before you get to the muscle. That's the fat layer. There's a fat layer underneath the skin and before the muscle. Some people have a lot of fat there, some people have a little bit of fat there, but that's where the medication is designed to be delivered. And over the next week, it slowly gets absorbed through the bloodstream, and it does its job. So that's where you want to inject the medication. Now, we've had patients come in here and they are injecting it into the muscle. They're injecting it into the skin, actually, the top layers of the skin. And then, unfortunately, we've had people come in here and try to say, or were thinking about injecting it directly into their veins. That's just a lack of knowledge, not knowing exactly how the medications work and how they're supposed to be delivered. Unfortunately, we see this all the time because people are not getting proper evaluations and consultations with doctors. And like I've said before, and I said 1,000 times, don't get your medications from the lady at the dollar store. So subcutaneous fat or the subcutaneous tissue is where the injections should be made. Number two, unfortunately, some people are reusing needles. Reusing needles is always a no-no. You don't want to reuse needles for any reason, even if it's on yourself. You are increasing the probability or the chances of getting an infection, because obviously the needle is sitting there for a week or some period of time between one injection to the next. Not only that, people don't think about this, but as you use a needle, it gets dull. Every time you stick it through a tissue, be it through the rubber stopper of your vial or into your skin, that needle gets more dull. And as it gets more dull, it hurts more. You're hurting yourself, possibly, by injecting yourself or reusing needles. So do not reuse the needles from one injection to the next. That's an absolute no-no, just about with any medication, but especially here with the GLP-1 agonist medications, which you're going to be doing at least, most chances, every 7 days. Mistake number three that we see here often in the office is not rotating sites. So the sites that are acceptable for injection, again, the subcutaneous fat layer, but the three areas that the medications are typically rated for when they are used in the trials and therefore gain FDA approval through the trials are the deltoid area behind the arm here is a good site, the abdomen on either side of the belly button, and also the upper thigh. So those are the three areas that are rated or approved by the pharmaceutical companies and therefore by the FDA because of the trials, the way they were done. Now, can you possibly inject into other places of the body and get a good result? It's possible, but why try them? Because they haven't been used in the trials and we don't know for sure. So use the for sure and don't use the guess because it doesn't make sense to invent anything at this point when it's already been tried and true with thousands of people through a trial, right? Makes sense. Now, rotating sites. If you use one arm, if you possibly, and you have another arm, you got to use the other arm. If you have one arm, you like that spot, next week, use the abdomen and then go back to the arm. The point is to rotate through sites, at least go back and forth on sides of the body. If another side of the body is not available, then use another injection site altogether. But again, the three that are approved are the upper thigh, the abdomen, and the deltoid. Number four, haphazard or changing or skipping dosing timing. Now, this is a problem a lot of times now. It could be an economic issue or it could be an availability issue. Those are the two reasons. And then you have commitment issues. People just are not as committed to the actual work of, lifestyle modifications along with these medications as a tool. So they skip a dose, they go out of town, they do this, they do that. Those folks are never really going to reach their goal because they're not committed anyway to lifestyle modifications. But if you are in an economic situation, you also have to understand that if you are trying to stretch the medication or just can't afford it on a weekly basis as you need it, you are also affecting or going to get an uneven result as a result of not injecting the medications as often as you should. Now, am I saying that because you are not in the position to get the medications on a regular basis as you should because of economics that you should not even take the medications? I am not. What I'm saying is that you may not have your optimal results as a result of not being able to inject the medications as you should. Right? Availability, also same thing. The availability of the medication to you can also and will also affect you the same, just as if you weren't committed or if you had an economic situation and not getting the medications as you should. So it's very important, if you can, get your supply in order, if it's economics or if it's availability, as you go along into this process, so that you can get the most out of this, right? And if you're not committed, you just might as well just go ahead and let the medications go to somebody who is committed, because we kick people out of this place all the time, right? We kicked people last week. Just, you're not committed. These medications are super rare, and we don't have time for the games. Reason number 5 for problems with things that people do wrong with injecting these medications is improper storage. Now, the medications are to be stored between 36 degrees and 46 degrees Fahrenheit, which turns out to be around 2 to 8 degrees Celsius on a daily basis. Now, there are reasons that you can take them out of those temperatures, but you have to use them immediately. You should not store them outside of those ranges, because then you may degrade the medication in the vial or inside the pen. And if you do so and inject yourself and you get an uneven result, that's what you're getting. But here's a pro tip. I do find that it is less painful for many patients if you remove the medications and let it sit and get close, outside of the cold range, and inject it then, and you get a more, tolerable injection experience. Now, I know it's only seconds. Most people just grit and tough it out, but everyone's pain threshold is different, and I respect that. So that's the information I give them to make sure that they stay on track with the medications and don't avoid the injection because it's just so painful, when we can avoid the pain many times by, 1, injecting in the right place, in the right spot, not in the muscle, not in the vein, but in the subcutaneous space, and 2, also injecting the medications at a temperature that's outside of the so-called temperature or refrigerated temperature that it is stored at, okay? So store it at the right temperature, let it warm up a little bit before you inject it, and typically you'll get a better experience, less pain-friendly folks out there. Number 6, is this something that most people don't think about, but you could get, pain and or the wrong dosage if you do not prime the pen correctly. Kind of hard to do it with the pen, but many times with the vial, if you don't prime the syringe correctly and get that one little tiny drop to come out the top, after you've loaded the syringe up and you go to inject yourself, you're going to inject a volume of air into your body and not all the volume that you want, right? And only that, when you load the syringe, not many Americans are used to loading up a syringe with medications. Remember, get all the air bubbles out, because we got too much air in there. That space is being used up by air and you're not getting the proper medication. So you may be thinking that you're injecting yourself with, let's say, 0.5 milligrams of semaglutide, when in actuality, because of the air bubbles that are in there, you're actually injecting yourself with a little bit less, maybe 0.4, maybe 0.35. I don't know, but I'm saying let's make sure to get the air bubbles out and prime the syringe if you can, just so you can get a little small drop at the top of the needle before you inject yourself, and then you'll make sure that you get the right injection amount of, the right dosage that week. Number 7, and this is for some of our, impatient patients, or sometimes we bring in training when we see that there's something going on here. Maybe bruising, maybe, not getting the even responses that we want. We have the patients come in and inject in front of us. And one of the things that we find is not using proper injection technique so far as being patient with injecting, right? So the procedure, typically when you inject the medications, you want to go ahead and grab the fat, just make a pinch, and then inject the medications, but inject fully. So some folks are needle averse, don't like pain, don't like needles at all, inject themselves and pull it out. Next thing you know, half the dose is all over the floor. And it happens week after week after week, and they really don't want to talk about it. But when we think we're giving you a full 1 milligram or 10 milligrams of tirzepatide or 1 milligram or semaglutide, whatever the medication is, and half of the dose is on your skin or on your shirt or on the floor, that is not effective. That medication is not going to do any of us, either of us, you or me, any good. It's not going to help you. What's spilled is not going to help. And not only that, this is expensive stuff. You want to make sure that when you do inject, you inject it in the right place and you inject fully so that you get the most out of the medication that you purchased. You spent a lot of money on this stuff. You might as well put it in the right place and make sure you take your time and get it done. If you need someone to do it for you because it's just a little too painful or just needle averse, your doctor, if it's a good one, like our office here, we do our injections here weekly anyway for all of our patients, just about. Very rarely do we allow medications to go out the door. We have our patients inject here in the office. So just for that, just to make sure that it's done correctly. But if you're taking it home and you're not good at it, you're not very, needle friendly or needle savvy, go ahead and bring it back to your doctor, bring it back to your injector, and they should, provide you with that service. It's just the way, that's just good service, right? So yeah, ask them to help you out. Number 8, and this is a pet peeve of mine. Something you should not do is dispose of the needles incorrectly. You should find either your pharmacy or back to your primary care doctor, whether or not they're giving you the medications or not. We all have in our office or in your injector, the person who prescribed the medications to you locally, bring those needles in there so they can be disposed of correctly. There's people in the streets that are, reusing needles and doing the wrong things with needles and can hurt themselves. Kids can find these needles, even in your own home. You don't want to have these needles lying around. What you can do is just go ahead and go to Amazon or whatever store you like, and you can purchase a hard box that when you're done, you could just lock it up and, close it up and drop it off at CVS or drop it off wherever. Any doctor's office will be kind enough to just put them in the red bag in their office and get rid of that stuff safely. So you don't want to incorrectly dispose of your needles as you're going along, because you're going to, believe it or not, you're talking about 12, 13, 14, 15, weeks, sometimes, months, a year. You're talking about 52 needles. There's a lot of needles that could be out there and people could get hurt. So yeah, dispose of your needles and your syringes in the correct manner. Number 9, not checking the dosage setting on either your pen or understanding the dosage conversions that you need to be injecting yourself through the vials if you're doing compounded medications, or if you're on the tirzepatide vial, the 2.5 and the 5 milligram self-pay program that they have through their website, and you're getting vials. So understand how many milliliters or units equal how many milligrams for the vial that you have. That is paramount. That is super, super, super important. As a matter of fact, here, I pretty much don't speak to people about how many milliliters they're injecting. I always make patients or people I'm talking to, even on, in the community that we've built or on YouTube, when they speak about how much they're injecting, I make folks speak about how many milligrams they're injecting, because many times we're speaking different languages. You're speaking, I get 20, I do 20 units. And the concentration of the vial that you have may be way different than the one that I'm working with over here. And I think you're injecting 2.5 milligrams and you're actually injecting double or less. It's crazy. So understanding how many milligrams per unit of whatever the syringe that you have, the units, when it says 10 or 20 or 30 or 40 units, those are insulin syringes, and they have their own, based off how many milligrams per unit is in the vial, has a milligram to it, like milligram doses. Usually there's like a piece of paper that comes with your vials, and it'll tell you 10 units equals 1 milligram. 20 units is 2 milligrams, and so on and so forth. Or it says something else. But knowing how much that is, and knowing that every single time you get a new vial that you have to check that piece of paper or check whatever the inserts are with that vial, is absolutely important, because you can end up, that's how folks come in here and say, well, week to week I was on this other medication, and next thing you know, I was vomiting and I couldn't go to the bathroom, and I had all these side effects. But wait a minute, you injected yourself mistakenly with triple the dose of medication that you're used to from last week. Got to pay attention on what the dosages are on those vials. Now the pens, make sure when you're clicking, whatever is in that box is what you're supposed to be injecting. So if last week you had, 2.5 milligrams of Zepbound, and then next week you're supposed to be on, 5 milligrams of Zepbound, but there was some problem with the pharmacy, and they gave you the wrong one. They give you 10 milligrams. Now you have given yourself, if you don't check, 4 times the medication that you wanted to put in your body. So what do you think is going to happen? Well, most folks are going to feel away, right? You're going to get instantly. You're going to feel like, whoa, this is nuts. Like, this didn't happen last week. Oh my goodness, this medication is not for me. And people may swear off the medication and all that good stuff without actually having a good valid reason to just come off the medication. It's just a mistake in dosage that they have. Now you have the multi-dosage pens, and that's another mistake that you could make. And instead of giving yourself what you're supposed to be giving yourself, you click too many times or click too few times, and also can give yourself an uneven result with the Zepbound that you are, or tirzepatide, or the Wegovy that you are injecting yourself with. So absolutely imperative to make sure, take your time, and click how many times you're supposed to click, or measure how many units or milliliters you're supposed to be using that syringe, and how many milligrams you're supposed to be getting according to those milliliters or units on the insulin syringe, if that's what you're using. And make sure you inject it in the right place, in the subcutaneous space, and also take your time and don't spill it everywhere. So there's a few steps there for injecting that you have to take care to make sure that you're getting done right? These are mistakes I see all the time. This is, avoidable. Ignoring side effects of your medications, complications that you may get. We all know what they are by this point. Most of us who have been, on my channel and who've been well evaluated and consulted with a professional who knows what they're doing should take the time. It only takes about 15 to 20 minutes to explain to you what the side effects or the complications are. So don't ignore them when they come up, right? There may be a reason for that. Maybe improper injection technique. It may be the medication is, you didn't dose it right. It may be, you put it in the wrong space or place in your body. You're not rotating sites, and you're getting bruising and getting pain. You're not letting it sit for a little bit. All of these complications should not be ignored. You should bring them up to your professional, your doctor, typically, and let them know so that they can help you through that. Because not every time it's just the blanket complication of the medication and I got to stop the medication. That's not typically the case. Very rarely are complications with the medications the cause or needed reasons to stop the medication. Usually those are things that we can work around and probably fix and keep you on the medication so you can get the benefit of the medications for as long as you need it. Yeah, don't ignore your side effects and complications. Don't ignore that. And besides, it could get just really out of hand. The next thing you know, you hate your doctor, you hate the medication, you hate life, you hate everybody. And we don't want that. We don't want that at all. And finally, although I didn't put any specific order on this, finally, number 10, and the most important one. When injecting these medications, it is absolutely, positively, absolutely necessary to get a medical professional to evaluate you, conduct a consultation, labs, and also an examination, and also to define your goals with the medications and how to get there, explain those complications I was just talking about, how to inject it, where you should inject it, what to expect, what not to expect, what types of food you should be eating, what are the macronutrients, what are the nuts and bolts of lifestyle modifications for weight loss that are necessary to make sure that you are successful. If you don't get that, you're just out here just injecting medications. You could always find me and figure it out, but why? Why should you do that when you already had someone sitting in front of you? And actually, quite honestly, it's their job and what you paid them for the consultation to get on the medications, for them to teach you how to put it in and how to manage the medications, right? So, or pay for the consultation. Pay for their time and get your questions answered and avoid the opportunities for failure and opportunities for complications that come along with misuse of the GLP-1 agonist medications when injecting the medications for weight loss purposes and obesity and all the complications therein. So yeah, if you'd like more of this type of information, you are invited, especially for our women, because we're slowly converting our community to a women's only group. To be honest with you, that's who's getting the most benefit. That's who's joining anyway. We're going to go ahead and change this group or modify the group, make it a women's only group. and get the most out of this. Go ahead and get a 7-day trial on me. Get in the group. If you're in the between the ages of 35 and, I don't know, 85, and you are looking for a GLP-1 agonist medications or lifestyle modification guidance, this group is absolutely for you, and it is going on in there. It's happening. I mean, it's a party. We're celebrating other days, and we're getting all this stuff done. So, hey, check us out. 7-day trial, free. It's pretty much on me. Check it out. I know you're going to love it. See you soon.